has expanded PHL Connected to include pre-K student households. PHL Connected launched last summer to provide free and reliable internet access to eligible K-12 households. Since its launch, the city has closely worked with the pre-K stakeholders to form a system needed to expand the program to include our pre-K families. Supporting early learning and the pre-K community has always been a priority for our administration. The past year has clearly shown that internet access is an essential service for people of all ages. As of March 2021, PHL Connected has made over 15,000 internet connections. We're continuing to conduct outreach to raise awareness about the program and make sure any eligible family gets connected. With this expansion, more families will be able to get the reliable internet they need. As always, we thank Comcast, United Way, and the funders that are making this initiative possible. Joining us for questions on this announcement are Chief Information Officer Mark Wheeler and Chief Education Officer Otis Hackney. If you are a pre-K to 12 family in need of reliable internet access, call the PHL Connected hotline to find out if you're eligible. Dial 211 for language services, press 8. Now, Dr. Farley's update.
Thank you very much, Mayor. I have better news today. This epidemic wave may be starting to decline. Here are the numbers. Since this time yesterday, we've identified 609 new cases of the coronavirus infection in Philadelphia residents by the PCR test and the antigen test combined. Now, for the past week, the 18th through the 24th, by the date in which the sample was collected, we averaged 458 cases per day so far. Expect more to come in later. And of those tested, 5.9% tested positive. And that's down substantially from the week before when we averaged 616 cases per day and 6.6% of people were testing positive. Now around us, the news is even better. The cases are falling in the United States right now. They're falling in New Jersey since about the 1st of April, falling in Pennsylvania about since the last week or so, and falling in Delaware in the past few days. So the fact that it's declining throughout the entire region is a hopeful sign for Philadelphia. Here in our hospitals, we're also seeing declines. Today, there were 481 people with coronavirus in Philadelphia hospitals. A week ago, that was 551, so we're going in the right direction. Now on deaths, we have 11 newly identified deaths today, bringing us to a total of 3,452. And we hit a low of 23 deaths per week in the week of March 21st. That increased to 56 in the week of April 11th so far. Now, the number of deaths that have occurred per week lagged behind the increase in cases. So we did expect that the number of deaths would rise above 50, and it has done that. I'll only turn to where we are with vaccination. We're clearly making progress. The weekly vaccinations, the number of doses that are being delivered is decreasing because most of the people who are very eager have already been vaccinated. But the number of people being vaccinated is still very large. For the week that ended April 18th, there were 104,000 total doses administered across all providers, across all persons. And the week ending April 24th, that's 74,000 doses administered so far. We expect a few more with late reports. As of Monday evening now, there are 736,000 people in Philadelphia that have received one or more doses and 488,000 people who are fully vaccinated. What does that translate to as far as what percent of people now are fully vaccinated? The best data source for that is for the Centers for Disease Control. And they're saying for Philadelphia that 34% of the people over the age of 18 are now fully vaccinated, and 55% of people over the age of 65 are fully vaccinated. So more to go, but we're clearly making great progress there. Now, the availability of vaccination continues to increase. We now have 275 sites across the city that are enrolled and receiving vaccine. That's an increase of 1 since last week. And now 52 independent pharmacies that are enrolled. And that's up to 3 since last week. Now, we do have our 2 large federally supported vaccination sites. We have the Convention Center and we have the site at Esperanza at Hunting Park. Those sites are using the Pfizer vaccine. They're delivering the first doses now, and they'll continue doing that for about another week and a half. Then they'll switch to 3 weeks of providing the second dose. Now, the Convention Center, in addition, is going to add the availability of Johnson & Johnson vaccine on Saturday. So on Saturday, they'll have availability both the Pfizer vaccine, first dose, and the Johnson & Johnson vaccine. We'll see how that goes, and if that goes well, we'll continue to offer the Johnson & Johnson vaccine at that site. Now, at our city-run neighborhood clinics, which we're continuing to run about 1 or 2 per day, run either by the health department staff or fire department, office of emergency management staff. Those continue in different areas of the city. The clinics that are run by the fire department were using Johnson & Johnson vaccine. So they paused for about a week while the nation paused on Johnson & Johnson vaccine. Those clinics are going to restart this week. And there's a calendar of all of these neighborhood clinics that is posted on a blog on our website. And all these clinics will accept people walking in. In addition to that, walking in, that is without an appointment. In addition to that, scheduling appointments at any of these clinics is easier than ever. So start effective today. If you go to our website, www.phila.gov/COVID, there's a red banner at the top. If you click on Get an Appointment, it'll take you to a new page with a list of these city-run clinics and their maps. There are hours of operations. There's the vaccines that are used. There's information about what appointments are available. And you can go in there and you can schedule yourself. So people can look across the entire city, all the different options, and they can schedule whatever is most convenient for them. Now, those are just the sites that are managed by government agencies. In addition to that, pharmacies and hospitals and clinics have their own online signups. And increasingly, these other providers are also accepting walk-ins, even if they don't all advertise that. Now, let me turn to our social distancing restrictions. So as I said earlier, there are signs that the current epidemic wave may be on decline. That's good news. And the changes week to week are as important as the number of cases. In addition to that, our vaccination rates are not high enough yet, but we clearly are making progress. And the vaccination opportunities are better than ever. So with that in mind, we will be backing off on some restrictions effective Friday, May 7th. Now, we have been more restrictive than either the Commonwealth of Pennsylvania or New Jersey. And our changes will get us closer to alignment with the Commonwealth as a whole. Here are the key points of the changes in our restrictions. For restaurants indoors, currently they are capped at no more than 25% maximum occupancy or 50% maximum occupancy if they meet our enhanced ventilation standards. With the change on May 7th, that'll increase to every restaurant being able to go to 50% capacity, and restaurants that meet our enhanced ventilation standards being able to go to 75% capacity. However, they still need to maintain the minimum of 6 feet distance from chair back to chair back, so people are still more than 6 feet away from people from other households. In addition, for indoor restaurants, we'll increase the maximum table size, which is currently no more than 4 persons, to no more than 6 persons, with no requirement that they be from the same household. That's for restaurants indoors. Restaurants outdoors are going to be much the same as currently, except that we will increase the maximum table size up to 10, which is the limit that the Commonwealth has. Now, let me talk about catered events indoors. Now, events like indoor weddings are settings that we consider to be the highest risk. The reason is because people know each other, they mix between tables, they spend a long time close together, they take their masks off to eat and drink, they take their masks off for the pictures, and if they're using alcohol, they tend to drop their guard and be less careful with each other. So we have many examples of COVID outbreaks that have occurred at weddings and other social gatherings like that. Currently in Philadelphia, our indoor catered events are limited to what I'll call business meetings. Those are meetings where there's no alcohol served, no music, and no dancing. And there's a cap of 250 persons at that in those settings. Catered social events like weddings have been prohibited in Philadelphia for months. So with the changes I'm announcing today, we will allow catered social events to start with up to 25% occupancy of the space in which they're taking place, and with a cap of no more than 75 persons. That's effective May 7th. Now, if the case rates continue to fall, we'll increase that cap from 75 persons to 150 persons as of May 21st. Still, though, I want to encourage people that are having these events, that are high-risk events, to do them outdoors as much as possible. Now, other gatherings and events, we will increase the capacity limits to meet the state standards at 25% capacity indoors and 50% capacity outdoors for other gatherings and events, effective again May 7th. Now, with these changes, I want to make this strong recommendation. This is not a requirement, it is a strong recommendation. Anyone participating in these higher risk or higher density events should be vaccinated first. Reason is that there's still plenty of people in Philadelphia carrying this virus. So the risk that there be someone in a setting with many people that's infectious with this virus is high. And it's now easier than ever to get vaccinated. There's no excuses. Anyone can get vaccinated, many different opportunities. So For those people planning their weddings and social events, ask now for your guests to get vaccinated in advance. Put it in your invitations. And in general, what should people do? So please, I want to recommend everyone get vaccinated. It's never been easier. And as long as you're getting vaccinated, bring anyone over the age of 65 who you know who's still unvaccinated with you, help them get vaccinated as well. And continue to wear masks, continue to keep their distance, and continue to avoid being around others when you can. All of our information is at our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. We will now move to Armando for a Spanish translation of Mayor Kenny's and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el 27 de abril de 2021. Buenas tardes a todos. Me complace anunciar que la ciudad ha ampliado PHL Connected para incluir a los hogares de estudiantes de pre-kinder. PHL Connected se lanzó el verano pasado para brindar acceso a Internet gratuito y confiable a los hogares elegibles desde el kindergarten hasta el 12º grado. Y desde su lanzamiento, la ciudad ha trabajado de cerca con las partes interesadas en pre-kinder para expandir el programa de manera que incluya a nuestras familias de pre-kinder. Apoyar el aprendizaje temprano en la comunidad de pre-kinder siempre ha sido una prioridad para nuestra administración. El año pasado nos ha demostrado claramente que el acceso a Internet es un servicio esencial para las personas de todas las edades. Desde marzo del 2021, PHL Connected ha realizado más de 15,000 conexiones a Internet y continuamos realizando actividades de divulgación para crear conciencia sobre el programa y así asegurarnos de que toda familia elegible se pueda conectar. Y con esta expansión, más familias podrán obtener el Internet confiable que necesitan. Como siempre, les agradecemos a Comcast, a United Way y a los patrocinadores que están haciendo posible esta iniciativa. Nos acompaña para responder preguntas al respecto el director de información, Mark Wheeler, y el director de educación, Otis Hackney. Si la suya es una familia de pre-kinder al 12º grado que necesita tener acceso confiable a Internet, llame a la línea directa PHL Connected para averiguar si es elegible. Puede marcar el 211 para hacerlo. Y para servicios de idiomas, por favor, presione el número 8. Gracias. Y estas son las palabras del comisionado de la salud, el Dr. Thomas Farley, para el 27 de abril del año 2021. Hoy iniciamos con mejores noticias. Esta ola de la pandemia parece haber comenzado a caer finalmente. Y comenzamos con los números del día de hoy. Hoy tenemos 600 nuevos casos confirmados de prueba PCR y de antígenos, con un total de 609, reportados desde el día de ayer, para un total en general de 137,500 casos. La semana pasada, del 18 al 24 de abril, el promedio de casos fue hasta el momento de 458 casos diarios, con un 5,9% de pruebas positivas. Estos números son ligeramente más altos si los comparamos con los números de la semana anterior, del 11 al 17 de abril, que tuvo un promedio de 616 casos diarios con un 6,6% de positividad. En los Estados Unidos, los casos están disminuyendo. En Nueva Jersey, los casos están disminuyendo desde el 1 de abril en Pensilvania aproximadamente hace ya una semana y en Delaware desde hace pocos días. Esto es un signo de esperanza para Filadelfia. Con respecto a los pacientes que han sido hospitalizados, tenemos más información que tiene que ver con los números de internamiento que tuvimos anteriormente. Las cifras van disminuyendo poco a poco. El día de hoy tenemos 481 pacientes con COVID-19 internados en los hospitales de Filadelfia. La semana pasada, en promedio, 551 personas estuvieron hospitalizadas. En cuanto a los fallecimientos, el día de hoy se identificaron 11 muertes por el COVID-19 con un total de 3,452 fallecidos. El punto más bajo registró 23 muertes la semana del 21 de marzo, pero este número aumentó a 56 muertes la semana del 11 de abril. A pesar de las señales de mejora, esperamos un aumento de muertes por COVID-19 semanales durante las próximas semanas. En cuanto a la actualización sobre el proceso de la vacunación, hay una disminución de las cifras de vacunación semanal. Esto se debe a que la mayoría de personas que estaban ansiosas de vacunarse ya fueron vacunadas, pero el conteo de casos sigue siendo aún muy elevado. Para la semana finalizada el 18 de abril, cerraremos con 104,000 dosis administradas. La semana que finalizó el 24 de abril, contabilizamos hasta ese momento 74,000. Para el lunes en la tarde, teníamos 736,000 personas que han recibido la primera dosis y 488,000 que están ya completamente inmunizadas. El 34% de los mayores de 18 años en Filadelfia están ya completamente vacunados de acuerdo a los datos de los Centros de Control de Enfermedades. El 55% de los mayores de 65 años están ya completamente vacunados, nuevamente de acuerdo con los datos de los Centros de Control de Enfermedades. Y la disponibilidad de la vacuna continúa aumentando. Ahora tenemos 275 sitios inscritos que ya están recibiendo vacunas. Los hospitales, las clínicas comunitarias y las farmacias siguen funcionando como centros de vacunación. Y ahora tenemos 52 farmacias independientes que están administrando las vacunas. En cuanto a la vacunación en el centro de vacunación de Center City, en el centro de convenciones de Pensilvania, se está administrando la vacuna de Pfizer en su primera dosis. Esto continuará durante semana y media y luego pasarán a administrar la segunda dosis. A partir de este sábado, el centro de convenciones añadirá la vacuna de Johnson & Johnson como una opción de vacunación. Con relación a las clínicas de vacunación ubicadas en los vecindarios que administra la ciudad, continuaremos abriendo 1 o 2 clínicas por día en diferentes áreas de la ciudad. Las clínicas del Departamento de Bomberos que administraban la vacuna de Johnson & Johnson se reanudarán. El calendario está publicado en nuestro sitio web y estas clínicas están vacunando sin cita previa. Para hacer su cita para vacunarse, esto es algo más fácil que nunca. Vaya a fila.gov/COVID y haga clic en Get an Appointment o haga una cita en el banner rojo. El enlace lo llevará al sistema de citas de la ciudad. Esta es una nueva página que tiene una lista de las clínicas administradas por la ciudad con mapas, horarios, vacunas utilizadas y citas disponibles. Usted puede programar su cita directamente. Las farmacias, hospitales y clínicas tienen sus propios registros en línea, pero están aceptando cada vez más personas que no han hecho una cita previamente. Con respecto a las restricciones y el distanciamiento social, hay señales de que la ola epidémica actual pueda estar disminuyendo. Y esto cambia de semana a semana, así que quiero aclarar que esta realidad es tan importante como el número de casos. Las tasas de vacunación aún no son lo suficientemente altas, pero claramente estamos progresando. Las oportunidades de vacunación son mejores que nunca. Daremos marcha atrás con respecto a algunas restricciones a partir del día viernes 7 de mayo para alinearnos con los dictámenes de la Mancomunidad. Para los restaurantes con comedor en interiores, que actualmente están operando al 25% o al 50% de capacidad, si cumplen con los estándares de ventilación mejorados, se aumentará al 50% la capacidad o al 75% de la capacidad en el caso de aquellos que cumplan con los estándares de ventilación mejorados. Igualmente, será necesario mantener la distancia social de 6 pies entre el espaldar de las sillas. También aumenta el tamaño máximo de la mesa, de 4 a 6 comensales, y no se requiere que sean miembros del mismo hogar. Para los restaurantes que ofrecen servicio al aire libre, se aumentará el tamaño máximo de la mesa a 10 personas. De esta forma, estaremos alineados con los límites que impone la Mancomunidad. Con relación a eventos realizados en interiores, en eventos como bodas o celebraciones en interiores, que son las de mayor riesgo, porque las personas se conocen, pasan mucho tiempo juntas, sin mascarillas, porque se las quitan para comer, para beber y para hacer fotos. Si a esto se le suma el alcohol, las personas tienden a bajar la guardia. Tenemos muchos ejemplos de brotes del virus en bodas y en otras reuniones sociales. Actualmente los eventos bajo techo se limitan a reuniones de negocio, es decir, sin alcohol, sin música, sin baile y con un máximo de 250 personas. Los eventos sociales con servicio de catering, como las bodas, han estado prohibidos durante varios meses. Se permitirá el inicio de estos eventos sociales con un 25% máximo de ocupación de espacio y un límite de hasta 75 personas. Y si las tasas de los casos continúan cayendo, se aumentará el límite a 150 personas a partir del 21 de mayo. Con respecto a otras reuniones y eventos, aumentaremos la capacidad para cumplir con los estándares estatales, 25% de capacidad en interiores y 50% de capacidad en exteriores. Esta es una recomendación que hacemos a las personas que están planeando organizar estos eventos. Cualquier persona que participe en estas actividades de mayor riesgo y de mayor densidad debe vacunarse primero. Todavía hay muchas personas en Filadelfia portadoras del virus, por lo que el riesgo que una persona en un entorno como este sea infecciosa es bastante alto. Y ahora es más fácil que nunca vacunarse. Entonces, para aquellos que planean bodas y eventos sociales, pida ahora que los invitados se vayan vacunando con anticipación. Pónganlo en sus invitaciones, porque nosotros tendremos que prevenir la prevención y la exposición al virus. La epidemia sigue aquí, sigue creciendo y sigue siendo mortal. No se confunda, esto aún no ha terminado. Por favor, utilice su mascarilla, mantenga la distancia social, evite estar cerca de otras personas. Y tan pronto como sea su turno, vacúnese y lleve a sus seres queridos a vacunarse, en especial a los mayores de 65 años. Solo con nuestro esfuerzo conjunto podremos superar esta pandemia. Muchas gracias.
Thank you, Armando. We will now move to Q&A for members of the press. In addition to Mayor Kenny and Dr. Farley, we are joined today by Managing Director Tumar Alexander. And as Mayor mentioned earlier, joining us today, we also have Chief Information Officer Mark Wheeler and Chief Education Officer for the city, Otis Hackney, to answer questions about the PHL Connected announcement. Because of limited time, only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer. We will limit the first round of questions on the topic of COVID-19. If you have questions regarding other topics, please hold them until the second round. If your hand is raised now and your question is not about COVID-19, please lower it and we will let you know when we open it to broader topics later on. So first up, we will go to Rosemary Connors of NBC 10.
I was actually just about to lower my hand because my question is unrelated to COVID. So I'll wait until the second round. Thanks.
Thank you, Rosemary. Appreciate it. Next up, we will move to Kelly Rule of Fox 29.
Thank you for taking my question. I know this was sort of asked last week, but wanted to reach out specifically when it comes to the indoor catered events, social catered events. If it becomes like a policy for certain venues to require that guests attending these events are vaccinated, would there be room to allow a higher capacity? Or are you still going to kind of have a enforcement across the board when it comes to that?
The problem with that is that it's really impossible to verify, for them to verify that people have in fact been vaccinated, or for us to enforce that, because it's very easy to fake a vaccination card. You can, I'm sure, on the internet get to do that. So I'm glad that they're encouraging people to be vaccinated, but I don't think that we can base policy on that.
Okay. And I apologize if you brought this up, but you are planning to keep the food requirement and the curfew in place at this time for indoor and outdoor dining? Yes, for indoor and outdoor dining, the alcohol can only be served with food, and there's still a curfew. And the reason for that is that it's late at night when people drinking and not eating, where we have the riskiest behavior from a COVID perspective. A lot of people get together, not wearing masks, getting very close together, lots of risk. And the bars are very high risk settings, so we're not making that change yet. Okay. Thank you.
Thanks, Kelly. We're now going to move to Martin Pratt of, sorry, I can't see the full name here, but Martin Pratt.
No problem. Thanks. Philly, your Black News. Dr. Farley, I'm not sure if you've seen the New York Times article that illustrated how COVID can move around a classroom without windows open. Mm-hmm. But in light of what happened, was reported yesterday in the counties of the students who received COVID or got infected with COVID, and also the teachers who were vaccinated and also got COVID. Can you speak to how Philadelphia school systems would be different than what was experienced in, I believe it's Monroe County?
As far as what's happening within Philadelphia school systems, I'd refer you to the school district. But let me just say, in general, get a bunch of kids together. The risk is not zero. We've had some transmission in schools. It's been relatively uncommon. You can reduce that risk with, improving ventilation in a variety of ways. I would recommend that teachers be vaccinated. I think that kids should still be back in school. I think that it's important enough to have that risk. If the kids get infected, kids are generally handle this infection fine, and the teachers should be vaccinated. So yes, there is a risk there, but I don't think that means that we should not allow children back in school.
For parents that are concerned if their child has been exposed, what would be the steps for them to take if the child is not exhibiting any immediate symptoms, but they're concerned? What should they do?
I mean, if a child has been exposed?
No, they're concerned. The child seems achy, they seem sweaty, but they're not exhibiting. They don't have loss of taste. They don't have any of the.
Children may have symptoms that are very atypical, and so if a child has any symptoms and have concerns, then I would recommend them be tested. And there's a map on our website about all the different testing sites, including whether children can be tested there.
And that's the map of the Department of Health for Philadelphia.
Yes, I mean it's a map of testing sites, not all of which are run by the health department. Mostly run by other people, but it's all the information we have on testing sites.
Thank you.
Thank you, Martin. We're now going to go to Shaira Arias of Telemundo.
Hi, thank you so much. So this is a question in Spanish for Armando. Armando?
Buenas tardes, Shaira.
Buenas tardes, mucho tiempo. Armando, la pregunta es básicamente sobre las vacunas de Johnson & Johnson. ¿Cuál es el plan de la ciudad para poder volver a darle esa confianza, ¿verdad?, a la comunidad que tal vez está temerosa, preocupada de poder vacunarse con la vacuna de Johnson & Johnson por toda la controversia que ha pasado y después el hecho de que obviamente pausaron el uso de la vacuna y ahora lo van a volver a utilizar? ¿Cómo ellos planean ganarle esa confianza a la comunidad?
Me imagino que esa pregunta va para el comisionado Farley. Dr. Farley, the question is in regards to the Johnson & Johnson vaccines. What is the plan that the city has in order to return the trust to the community that is fearful and has misgivings and is preoccupied about the controversy that followed the pause to the Johnson & Johnson vaccines?
First, let me say that the risk from the Johnson & Johnson vaccine, while it's real, it's very, very low. For people in general, it's about 1 in a million. And even for younger adult women, it's maybe 1 in 100,000. And those are much, much lower than the risk of not getting vaccinated. Because the only choice you have is being vaccinated or not being vaccinated. And so we're still delivering the message, everyone should be vaccinated. If people, and we're going to make Johnson & Johnson vaccine available, we'll find out if people are hesitant to use it. Before this pause, people were seeking out the Johnson & Johnson vaccine because it is much more convenient to have a single dose rather than 2 doses. They may still do that. We are going to be communicating in general about the value of vaccination. We already are doing that. You're going to see more of that in the coming weeks. You're going to be hearing people talking about that more. And if people are hesitant about the Johnson & Johnson vaccine, they have ample opportunity to get other vaccines because there's plenty of opportunity for the Pfizer and the Moderna vaccine.
Obviamente, nosotros queremos hablar del asunto de las vacunas de Johnson & Johnson porque es una preocupación real, pero hay que recordar de que el riesgo con respecto a esas vacunas es bastante bajo, es incluso de 1 en 1.000.000 y en el caso de las mujeres jóvenes va a 1 en 100.000 casos, que todavía es mucho más alto el riesgo de no vacunarse. Entonces vamos a continuar con nuestro mensaje, que es que todos deben de vacunarse. Tenemos la vacuna de Johnson & Johnson ya disponible y si vemos que hay duda por parte de la población a raíz de la pausa que se sucedió, entonces vamos a tratar de expandir las otras vacunas que están disponibles para aquellos que tienen la duda. Y nosotros tenemos entendido de que antes de la pausa muchos buscaban esta vacuna en particular por la conveniencia de que es solamente una dosis. Entonces vamos a reforzar nuestro mensaje y vamos a comunicar el valor de hacer que todos en la ciudad estén vacunados. Gracias.
Just to reiterate, él había mencionado de que empezando el sábado, yo solamente quiero que me lo recuerden, empezando el sábado va a estar disponible en both FEMA sites o cómo es que eso va a funcionar. Y entonces si ven que no la están utilizando, la van a quitar y solamente van a tener Pfizer y Moderna disponibles. Pregúntale sobre eso.
¿Cómo no? ¿Y te refieres a la vacuna de Johnson & Johnson?
Y como que él mencionó que era el sábado y entonces como que yo quería estar segura que va a estar disponible en los 2 sitios de FEMA, empezando el sábado.
Dr. Farley, Shara is asking whether the Johnson & Johnson vaccine is going to be available beginning on Saturday in both FEMA sites. And also, if you feel that people are not taking it, will we withdraw? But this is basically a question whether the Johnson & Johnson vaccine will be available beginning Saturday on both FEMA sites.
The Johnson & Johnson vaccine will be available Saturday at the Convention Center. Not planned currently at Esperanza, but we'll see how that works out. Where there are 2 different lines, one for Pfizer, one for Johnson & Johnson. If that works out well, and if people are enthusiastic about having that choice, then we'll see if we can make that available in other sites too.
La vacuna de Johnson & Johnson va a estar disponible solamente en el centro de convenciones y vamos a ver cómo está el resultado, qué acogida le da a la gente. Si vemos que está bueno, entonces podemos expandirlas a otros sitios. Por el momento no está disponible en Esperanza, solamente en el centro de convenciones de Pensilvania, en el centro de la ciudad. Gracias.
Thank you. That's all for me.
Thank you, Shira. We'll now go to David Morrell from Philly Mag.
Hi, thanks. Just a couple of quick questions for Dr. Farley. I'm wondering, can you share what percentage of capacity has been filled, say on average over the last week or so at the Esperanza and Convention Center sites? I think they were maxing out at 6,000 and 2,500 doses, respectively. So just curious, on average, what you've been seeing in terms of shots given at those sites over the past week or so.
The convention center could do up to 6,000 people, and it's done between 500 and 1,000 over the past few days. Esperanza, it's been in order of a few hundred people. Now, Esperanza, we plan to do more like 1,000 and perhaps 1,500 on weekdays. And so it's definitely substantially less than what it's capable of doing. In general, having these very huge, very high volume sites around the country that era is passing, and the place they've reached most people now is more on distributed sites. And so we're going to be increasing our opportunities as much as possible in neighborhood sites.
That was my other question. How about at those neighborhood clinics? Are you seeing, about how many people are getting vaccinated at those per day? Because I think they could accommodate up to 500 if memory serves.
Yeah, each one's a little different according to the space, but the demand there has stayed pretty high. So they've continued to do 400 to 500 a day, maybe 350. And so the message we're taking from that is that the people who are not vaccinated yet are people who prefer to be vaccinated closer to home.
And finally, and I may have missed this because I had to join 2 minutes late, but the vaccine interest form, is that more or less obsolete at this point now that a person can, sign up directly on the city or just walk up into any of the city-run or FEMA clinics?
Right. If it hasn't been closed out yet, it'll be closed out very soon because, at this point, it just creates an additional unnecessary step where people can just schedule themselves directly. People who are in that database will continue to be getting contacts about their opportunities, but it doesn't make sense for additional people to put their name in that database.
Got it. And actually, sorry, just a final thing. The RFPs for the vaccination clinics for the first batch that included the Black doctors, have the dollar amounts been settled for those yet? Because last I heard they hadn't been, but
there for 3 or 4 of them, not all of them, and I don't have the numbers with me.
Okay, I will follow up just about those ones. Thanks.
Thank you, David. We'll now go to Jack Tomczak of Metro.
Thank you. These questions are for Dr. Farley. Have you had a chance to look at the new CDC guidance today on mask use outdoors for fully vaccinated people? And what are your thoughts?
And I didn't see the guidance itself, but I did see a press report on it. And what they are saying is currently, and our recommendations as well as theirs has been, if you're outdoors and you're more than 6 feet away from others, you don't need to wear a mask. But if you're within 6 feet of other people, you need to wear a mask. What they're saying is if you are vaccinated and you're outdoors and you're within 6 feet of a small group of people, then you don't need to wear a mask. So it's a relatively small change. We will follow those recommendations. I think that the larger message for people, though, is get vaccinated. And if you're in a crowd of people outdoors, still wear a mask.
Okay, and so for the convention center on Saturday, people will have the opportunity to get they'll have the choice of J&J or Pfizer.
Correct.
And where is the J&J vaccine being used now?
There are a number of providers that have had it in the past and will use it again. For example, there are some hospitals that have programs where they're doing vaccination of homebound people. And it's perfect for that because it's very difficult to go more than once to someone. There are the clinics, as I said, that the fire department is running in neighborhoods. Some pharmacies have it. Some hospitals are using it to vaccinate their inpatients, particularly those who are going to be transferred to nursing homes because it may be hard for them to get their second dose. So it's particularly important for those people for whom it's hard to get a second dose.
Okay, thank you.
Thank you, Jack. We'll now move over to Johan Calhoun of Chalkbeat.
Thank you. I have quick questions for Dr. Farley. Have you had the chance to look at the district's COVID dashboard and wanted to get your thoughts on those numbers?
I have not looked at their dashboard.
Okay. I believe it says about 18,000 students and staff have been tested, and about a little over 400 have tested positive. So, would it have helped if students, specifically those age groups that return back to schools in phases, would it have helped if they were vaccinated? I know you were pushing for the teachers, but we're talking about the students.
Well, the current vaccines are not authorized for anybody under the age of 18 for Pfizer or Johnson & Johnson, or under the age of 16 under 18 for Moderna or Johnson & Johnson, or under 16 for Pfizer. So the children in school right now are not eligible for vaccination.
Okay. You mentioned less restrictive measures earlier for restaurants and indoor events. What about the schools? I asked this because middle school and some high school students are returning to school Monday, and you're talking about larger bodied students who socialize more than early learners. So any measures for the schools?
Our recommendations for schools are just the Centers for Disease Control's recommendations for schools. We're not making separate recommendations for them now. And so nothing that we're announcing here today changes those recommendations for schools.
Thank you.
Thank you, Johan. We'll now go over to Kennedy Rose of the Philadelphia Business Journal.
Hi, I have a quick clarifying question for Dr. Farley. I was wondering, for indoor catered events, will that 75-person cap be for the entire venue or just for the party within the venue? I understand that you factor in staff when calculating capacity standards for venues like stadiums, so I was just wondering if I can get that clarified.
That would be for the entire event, which would include staff as well.
Okay, so if somebody was having a wedding and there's 25 staff members, they would only be able to have 50 attendees?
Correct.
Okay. And I was wondering, how does the city plan to enforce this guidance on indoor catered events, especially since it was one of the last things to remain closed? Are you taking the gym route? How does that go?
Still, we'll work that out. We've just now decided what the rules are going to be. Caterers are subject to inspection from our restaurant inspection team, and so we certainly we can inspect whenever we want. We do inspect on complaint. For the most part, we ask people to simply follow the rules. That we can't be everywhere all the time, and I'm hoping people will listen to our rules and recognize that they're for their own safety.
Okay, thanks so much.
Thank you, Kennedy. We will now move over to Laura McChrystal with the Inquirer.
Hi. Dr. Farley, another follow-up question on the indoor catered events. I'm hoping for clarification on what the mask requirement is there. If people are vaccinated and following that cap, do they not need to have a mask on, or can they only take it off to eat? What's the guidance there?
They're still required to wear masks, and they would only have their masks off when they're eating. And they should only be eating when they're seated. And we are not making any rules contingent upon vaccination because, again, we know we can't enforce vaccination. We strongly encourage everyone to be vaccinated, but those are the rules. For all these areas, we will post detailed guidance. What we just decided now is the larger issues. And so by the end of the week, you'll see detailed guidance on this.
Okay, thank you. And I'm also wondering, as vaccinations continue, has the city had any trouble getting people who got a first dose of the vaccine to show up for their second dose? Has that been an issue at all?
Your voice dropped out for a second. Can you repeat the question again?
I'm sorry. I hope you can hear me better now. has there been an issue at all with people getting their first doses and not showing up, or the city having a hard time tracking them down to receive the second dose?
There has been a problem with some people not coming in for their second dose, and we are communicating to people. We have the ability to communicate with at least some of them to remind them of their second dose and remind them of the importance of getting their second dose.
Okay, and lastly, as you loosen some of these restrictions, do you have a timeline hypothetically in mind for a further loosening as vaccinations continue?
We don't. Up until about a week ago, our case rates were rising, and so we were reluctant to put out any sort of long-term plan. With case rates falling, we are in a position now to start thinking about, all right, maybe they're falling through a combination of this epidemic wave being spent and vaccination. And if that's the case, given where we are with vaccination, where do you think we'll be in June, July, August, September? And so we can start to do some of that longer term planning now, but we haven't done it yet.
Okay, thank you.
Thank you, Laura. We have one additional question in this first round, and then after we get through this, we will open it up to a second round of questions. So if you have additional questions, please raise your hand now. So we'll go to Katie Catra of 6ABC for this final question in the first round. Katie, it looks like you're still on mute.
Okay, can you hear me now?
Yep.
Okay. My first question is how is Philly proceeding regarding the new CDC recommendations about not having to wear a mask outside if you are fully vaccinated?
I answered that just a minute ago, but just to summarize, we don't think it's a large change. We will follow the CDC guidance. So people, if you're unvaccinated and you're outside, you should be wearing a mask when you're within 6 feet of anybody. If you're vaccinated, if you're with a small group, you don't need to. And anybody outside, if they're not near anybody, doesn't need to wear a mask.
Thanks. And I don't know if anyone asked this, but there are 4,000 doses set to expire at the convention center. Do you know about that?
Yes, there were some doses. I don't have the exact number that were available at the convention center. And in case there were a larger volume of people, and we are redistributing that to other providers so that we can use as much of that up before they expire.
Okay, thank you.
Thank you. So for this second round, we will first go to Rosemary Connors of NBC 10.
Hey, thanks for that. So I have a question for the mayor and a question for Commissioner Farley. Mayor Kenny, I'll start with you. And this is related to the new developments in terms of the move bombing and the remains. Is there anything you would like to say directly to the Africa family as it relates to these remains that were not in their possession?
Well, certainly the move situation back in the day was a tragic chapter of Philadelphia's history, and hopefully they'll never be repeated again. And to the family, I would just say I think it's additionally sad that they're not been able to lay their family member to rest. I understand that Penn is potentially in conversation with them to see what their wishes are, and we'd be standing by to try to help in any way that we can. But it's, I'm from an Irish Catholic background, and we take very seriously when people pass and how they're handled and where they lay to rest. And I feel for the family, and if we can help in any way, we're here to do that.
Okay. Dr. Farley, I understand that your office and the medical examiner's office is going to be conducting an investigation on that end. Is it possible that the medical examiner's office received, or I guess the question is, who would have given the medical examiner's office authority to give the remains to the now retired Penn professor?
I mean, this happened 35 years ago, and no one at the medical examiner's office now was there at the time. Medical examiners, people don't know the answer to that now. I understand the medical examiner is looking for records to see if I can shed any light on that.
Can you, and I don't know how much detail you can give, but what will your investigation entail, and when may you have some answers?
I don't know. I think I'm just asking you to follow up to see what the medical examiner has to say about that.
Thanks.
Thank you, Rosemary. We will now move to David Morrell of Philly Mag.
Just a quick follow-up question relating to the second dose no-shows. What percentage of people are not showing up? And I think I had asked I had asked that question maybe a couple of weeks ago, and I think Dr. Farley, you'd said it was about 90% are showing up. So I'm wondering if it's a significantly different number now that we're kind of that was kind of the eager group of people to get vaccinated. So if it has changed or not.
I don't have a number in my head, and we can see if we can get you a number.
Okay, thanks.
Thank you, David. We will now go to Argenis Figueroa of Univision.
Hello, good afternoon. My question is going to be for the mayor, but I will need Armando for help.
Buenas tardes, Argenis.
Buenas tardes, Armando, gracias. Armando, me gustaría preguntarle al alcalde si nos puede decir qué significa para él la asignación de recursos a través del Fondo para la Resiliencia de la comunidad de Kensington, conociendo que es uno de los lugares con más problemas en la ciudad.
Tu pregunta, para reformularla, es qué siente el alcalde o qué opinión tiene con respecto a la asignación de fondos a la comunidad de Kensington.
Perfecto, sí.
Mayor, the question is for you. What are your thoughts or your feelings about the assignation of funds to the Kensington community?
I'm sorry?
What is your feelings or your thoughts about the assignation of funding for the Kensington community?
I'm not. Tumar, do you have any? I don't understand the question. What is?
¿A qué te refieres, Argenis, exactamente con la asignación de fondos para Kensington?
Hoy se está lanzando una serie de grants para organizaciones en Kensington.
Argenis, this is Mike Dunn. Tumar, he's referring to the Kensington Community Resilience Fund that was.
There's funds that have been announced today.
Armando, I think I think we're excited about it. One, because it's a way for us to get money into community groups and community members that's on the ground, get funding, fund a little seed money to them to do different programs. We certainly thank the philanthropy community for committing to that fund. And hopefully we could show within a really short amount of time that those funds are going to good use. And then we could go back to philanthropy and see if we can increase that funding. But I just want to say that I do want to thank the sort of opioid response unit and Deputy Managing Director Joanna Oteri Cruz and her team for putting that program together. And as I'm told, the community is excited to be a part of that and look forward to receiving some of that funding.
The other aspect of that program is that the neighbors themselves and the residents will have input into who gets the grants. So they'll feel as if they're actually directing the money to the needs that they see as a priority.
Nos dice Tumar Alexander que por supuesto la ciudad se encuentra bastante emocionada de encontrar nuevas maneras para fundar estos programas comunitarios que van tanto a los grupos como a los miembros dentro de la comunidad y que hay que agradecer a la comunidad filantrópica que hace que esto sea posible y que esperamos que en el futuro cercano podamos mostrarles que sus fondos han ido a un buen propósito, creando buenos resultados. Queremos particularmente felicitar a Joana Otero Cruz, cuyo departamento ha hecho estas peticiones de estos fondos disponibles. Entendemos que la comunidad se encuentra bastante emocionada de poder contar con ellos. Agrega el alcalde de que este caso en particular es especial porque han sido los vecinos quienes han delineado las peticiones en cuanto al dinero que se está entregando y ellos van a ver que estos dineros están yendo para hacer realidad sus sueños. Por lo tanto, estamos todos muy emocionados y muy agradecidos.
Perfecto. Muchas gracias. Es todo.
Cómo no, Argenis.
All right, seeing no other questions or seeing no other hands raised for questions, that concludes our weekly briefing on COVID-19. Thank you to all of our participants. Dr. Farley will hold a press conference on Friday, and the mayor and Tumar will join us again next Tuesday. Thank you, everyone.